How type 2 diabetes happens. Type 2 diabetes is a common metabolic condition that develops when the body fails to produce enough insulin or when insulin fails to work properly, which is referred to as insulin resistance. Insulin is the hormone that stimulates cells to uptake glucose from the blood to use for energy. When this is the case, cells are not instructed by insulin to take up glucose from the blood, meaning the blood sugar level rises, referred to as hyperglycemia. People usually develop type 2 diabetes after the age of 40 years, although people of South Asian origin are at an increased risk of the condition and may develop diabetes from the age of 25 onwards. Type 2 diabetes often develops as a result of overweight, obesity and lack of physical activity, and diabetes prevalence is on the rise worldwide as these problems become more widespread. Type 2 diabetes accounts for approximately 90% of all diabetes cases, the other form being type 1 diabetes, and treatment approaches include lifestyle changes and the use of medication. Types of diabetes. Also known as juvenile diabetes, type 1 diabetes usually occurs in childhood or adolescence. Type 2 diabetes is significantly more common than type 1 diabetes. Symptoms of type 2 diabetes. The increased blood glucose level seen in diabetes can eventually damage a person's blood vessels, nerves and organs. The body attempts to remove the excess glucose through urination, and the most common symptoms of type 2 diabetes include the following: polydipsia, increased thirst; polyphagia, increased hunger; polyuria, increased frequency of urination, especially during the night; extreme fatigue; weight loss and sudden loss of muscle bulk. Some of these symptoms are also seen in type 1 diabetes, but type 2 diabetes symptoms tend to develop more gradually and can take months or years to manifest. This can make it more difficult for people to tell they have an underlying health condition, and often people have had type 2 diabetes for a long time before it is finally diagnosed. Complications of type 2 diabetes. The high blood glucose seen in diabetes can damage blood vessels, nerves and organs, leading to a number of potential complications. In some cases, people who have had type 2 diabetes for many years are eventually prescribed insulin injections. Maintaining a healthy blood glucose level, blood pressure and cholesterol is essential to preventing the complications of type 2 diabetes.